Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Dr. Mark Klein, Chief Medical Officer at Children's Hospital of New Orleans, about the real risk COVID-19 presents to children and how low vaccination rates among those 5 and up are keeping too many of them vulnerable to infection. Let's listen. Dr. Mark Klein, thank you for joining me.
I'm so happy to be here. Thank you.
So we've heard a lot since the start of COVID that COVID doesn't really impact kids as much as it impacts adults, and that COVID in kids is basically harmless. But now we're hearing that's really not the case, and we're seeing that during Omicron. What are you seeing?
Well, I think you summarized it. We've spent most of this pandemic rebutting myths. Initially, people said the virus is essentially harmless for children. Then they said, if there's any harm at all, it's only for children who have underlying medical conditions. If they get sick, they won't require hospitalization. They certainly won't die. But here we are, about 2 years into the pandemic. We know that about a third of the children who are hospitalized with COVID today have no underlying medical conditions. We know that nearly 1,000 American children have died of COVID. We know that many thousands more have been hospitalized, some of them in the intensive care unit, some of them requiring mechanical ventilation. And we know that about 6,000 have developed MIS-C, which is this multisystem inflammatory condition that can damage several different organs in the body. We don't know what all of the long-term ramifications of that condition might be. And so COVID is anything but harmless for children. Fortunately, many children have relatively mild disease and recover uneventfully, but some require hospitalization, some end up in the intensive care unit, and some, unfortunately, will die.
Why are we seeing these record numbers of hospitalizations?
Yeah, well, Delta was a really sinister variant. Here in Louisiana, we dealt with Delta over the course of the summer, July and August, and it was incredibly virulent. It landed a lot of kids in the hospital. Omicron is a different animal. That's what we're dealing with right now, and it's just so incredibly contagious. I've never seen anything like it in 35 years as an infectious disease specialist. It transmits very, very easily. It may or may not be milder than Delta. I think that remains to be seen. I think we've taken some comfort in the statements of many experts who say that it is, but I don't know. We're still seeing a lot of kids land in the hospital, and even today, we have several children in the intensive care unit here at Children's Hospital New Orleans. It may be milder overall. Maybe the proportion of children who require hospitalization will be smaller, but with so much community transmission of Omicron going on right now, so many children becoming infected in the community, just the sheer numbers mean that a lot of kids will end up in the hospital.
Is this partly because kids are not vaccinated at the same rates as adults?
Yeah, that's a big part of it. The number one thing we could be doing to prevent hospitalizations and deaths among children is vaccinate children 5 years and up. Of course, all of those children are eligible for vaccination at this point. Under age 5, it takes a little bit of a different strategy. We need to cocoon those children or insulate them from unvaccinated adults. So we need to surround them with adults who've done the responsible thing and gotten vaccinated. And we've done a poor job of that. But if you look at the numbers of children 5 to 11 years of age and 12 to 17 years of age who've been vaccinated, frankly, the numbers are pathetic. Only about 23% of American children between 5 and 11 have had even one vaccination shot at this point. I think about 60% of adolescents 12 to 17 years of age have been vaccinated. We're doing a little bit better there, but we've got room to move on both of those. And the way out of this, the path out of this is through vaccination.
And as you said, under 5, they're not eligible. My question is, when will they be? I feel like I've seen that things aren't going as well in the Pfizer trials, for example, of kids that young.
Yeah, I think Pfizer hit a little bit of a glitch. They have not arrived at a dose of the vaccine, as I understand it, that is protective for kids across that age range, 0 to 5. Moderna may be a little bit further along at this point, as I understand it. They have data that they are preparing for submission to the FDA. And so I'm hopeful that we will have emergency use authorization for a vaccine in children under 5 sometime within the next several months, but it remains to be seen. The FDA has to look at the data and confirm the efficacy and the safety of the vaccine, and then the CDC does what they do. And so it's a multi-step process to get it to approval. And I can promise you that no corners are going to be cut when we're talking about kids under 5 years of age.
What's it like in your hospital right now when it comes to COVID? I mean, how does it feel?
It's a pretty traumatic time for the staff, I would say. We've been through 4 of these surges now. And I think we all had just kind of caught our breath after the Delta surge of the summer. And now we're being slammed by Omicron. The test positivity rate in our outpatient setting, so in our emergency department and our primary care clinics, has gone from about 5.2% to about 27.8% in just 2 weeks. And so that indicates how much community transmission of the virus is occurring among children. And then the hospital census, the number of children hospitalized for COVID has increased from 3 to 23 as of today over the same time period, over a period of 2 weeks. And so we're dealing with a lot of sick kids. And attendant with that has been, unfortunately, many of our staff have fallen ill with COVID because of the extreme transmissibility of this variant. And so we have about 170 staff that are currently out with diagnosis of COVID, and that strains our ability to deliver care, not just to children with COVID, but children with all of the usual medical conditions that we see day in and day out.
Now, I saw that New Orleans is going to make vaccination mandatory for 5 to 11-year-olds. That seems very unusual. Could you tell me about that?
Yeah, I think we're very fortunate in Louisiana in one sense, and we have some forward-thinking leaders. Governor John Bell Edwards for the state of Louisiana, Mayor Cantrell is our mayor here in New Orleans, and they have followed the science. They mandated masks when others hadn't, including in the schools for kids 5 years of age and up, and for all of the staff members in the schools. That was a statewide mandate. Here in Louisiana, or rather in New Orleans, Mayor Cantrell now has extended an order that she already had in place that pertained to adults, saying that adults had to show proof of vaccination or a very recent negative COVID test to get into restaurants and other public places. Now that's been extended to children as young as 5 years of age. The other thing that's happened is that in the Orleans Parish public schools, vaccines are now being required. That's also very unusual nationally. The Orleans Parish schools have said that by February 1st, in order to attend school, the kids have to be vaccinated. So I salute our leaders for these decisions. They're obviously very difficult decisions to make politically. There's been a lot of opposition to them, but they're the right thing to do. And I think we could be dealing with a much worse problem than we are if they weren't in place.
I think it's really a model for other places. I know that even my 17-year-old isn't required to have a vaccine for COVID to go to his school in Maryland, which is considered progressive.
Yeah, the governor announced about probably been a month ago now that there would be a statewide mandate pertaining to all public and private schools, adding the COVID vaccine to the routine list of vaccinations that are required for attending school and daycare in the state of Louisiana. There was tremendous opposition from the Republican-dominated legislature, and it's going to play out in the courts, I guess. But best I can tell, the governor has the right to do that along with the Louisiana Department of Health. But again, I concur with what you said. I think it's a model for what I wish many other states would do.
Before I let you go here, I wanted to talk a little bit about sort of what kids have faced in the last 2 years. I know I watch my own 15 and 17-year-old and how they've navigated through incredibly uncertain times. Talk to me about the psychological impact this is having on children, both in school, out of school. I mean, what are you hearing?
Well, it's uncharted territory. So I guess many of the impacts will only become clear over time as they play out. But certainly the opportunities for social interactions have really been reduced. Kind of the things that we see as the usual rites of passage of childhood and adolescence have been put on a back burner. And, 2 years is the blink of an eye in the history of our country or in the life of somebody who's my age, but it's an eternity in the life of a 5-year-old or a 7-year-old or a 10-year-old. And so I think the impacts are very real to their socialization, to the acquisition of knowledge. We know that in-person learning is superior to the kind of remote learning that we've had over the past couple of years. But we also know that in-person learning is only possible if it's done safely in such a way that kids aren't out of school repeatedly, isolated or quarantined, and if teachers can stay in school safely. So, and we haven't quite found a formula for accomplishing that. This Omicron virus, as I said a few minutes ago, is a whole other animal. And it's just unfortunate that it's hitting and peaking just as kids come back from the holidays and are back in school. It's a bad combination of events. And while I concur with the intent of getting kids back to school for face-to-face, in-person learning, I worry that the virus is going to have the final say on whether we're able to do that.
Mark Klein, thank you so much for joining me.
You're very welcome. Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.